Yeah, good day to all. I think all along we are seeing looking like me an odd man out because among the surgeons I am standing here. Basically, coming from my 36 years of experience in space, how that can get amalgamated for this particular venture of Indian system coming because today the time has come in India. Why it has not happened past, let us not worry about that. Now the time has come, they definitely will look for the future. The future is point of view, I feel it's a very, very bright in various things, all the way from Indian soil to the aerospace is concerned. I think probably we can think about that. Now looking at here, healthcare in India and developing countries, Brazil also told there, that way the large number of rural and urban primary health centers are there. That's a viably, it's available, the market, virgin market is available. Connecting specialists to primary health centers is the need of the hour, and that way point of view also we are working out some models are there. So towards this telemedicine, yes, somewhere or other, already with our INSAT satellites are there, in some form or other there, and telediagnostic and teleoperation. I think this is the way probably things will keep happening. Eventually, I foresee, I think Sudhir also talks about that, manned space missions also may need this surgery is concerned. I think that's scary. Then beyond all these things, today you know that irrespective of the profession, being an engineer, whomever it is, even the teachers, on the move their availability is being called for. I think day is not far when the surgeons also such requirements will come and you will be ready with that. Technology probably will be able to do that also. The Chandrayaan 2 mission, they landed on a very, very hostile terrain in the South Pole is concerned, very softly and landing when the nearly 1.3 billions of people are trying to watch. It was looking like a very, very magically it's going to land, look like simple, but lot more happened beyond that, When that happens on the moon or Mars, why not Indian medical healthcare also cannot get that with the fidelity here? I think that is the purpose we are looking at here. So you look at here in the various domains. These are all the robotic systems working in a space, maybe 400 kilometers away, and on the moon or Mars also. You look at your Pragyan rover also coming out there. So these very many things happening on the space. It is a real requirement because there you cannot go and do manually. You have to do that. Having done that, that's the things how we can take it down the line here. So that means symbolically look at here. Whatever the model, whatever I told here, that system, it works. Teleoperation supporting ground systems are available. That ground station may be from US, it can be from Madrid, it can be from India, it can be from Australia. But whatever it is, you route it there, depending upon the planetary system, which is visible from that place, it reaches there and the operation keep happening there. And similar way looking at here, even the treating the patient also possibility exists. I think that's what SSI mantra. When we're talking about teleoperations coming, today you look at here, it's more like a master control mode, it's happening there. Patient side robotic arm cards are there. Master controller, basically surgeon is trying to do, and he is aided by a 3D monitor. But now you look at here the time delays, whatever you are seeing, whatever you see from the thing and what you are going to react to point of view. That means overall, typically a 100 millisecond delay is there, which most of the people will not able to really perceive. You think it is the real time, but it is really happening. But SSI Mandra uses the field bus data communication, technically point of view, the protocol system that can give up to 300 nanoseconds communication delay. So overall system point of view, the delays are not very much. Now you look at here, this is the thing sitting there, as if your card system as well as robotic arms are sitting there. But now you take the away. Today maybe a few kilometers away. Tomorrow, let us assume 100 kilometers away from Delhi, you want to operate somebody in Kashmir, somebody far east, you want to operate. The distance now, along with emerging technology happening within India, 5G and 6G coming, and we expect that delay is not going to add more than 20 to 40 millisecond additional delay. Okay, that is, we are not going to perceive that much point of view. So at the maximum within 150 milliseconds delay, we will be able to do anywhere to anywhere India possibility exists. This is not a really dedicated line, it is a publicly available line being used, and that is not giving more than 25 to 40 megabits per second data rate. And whereas what we are talking about is 5G or 6G coming, we are talking about somewhere around 400 Mbps to 500 Mbps thing, and the latency is going to be anywhere to anywhere in India, it's not going to be more than 25 to 450 milliseconds. So all the putting together, whatever we are going to demonstrate here, it can be still enhanced. This is called a portable surgeon console. I think Vishwa has stored portable mobile robotic system there. But this is even the surgeon also on mobile, on his car, it is possible to fit with such a things there. And this can be made available, and so that even on the move, this is the first step to make surgeon availability on the move. So surgeon can be anywhere, but the requirement comes, you can get connected there. Wherever you go, you can be a surgeon when on the call, on the requirement possible. Because when we told we can go to the moon, people thought we are the fiction. When we told we can go to the Mars, people thought the fiction. When we go to the sun, yes, now people are believing, yes, Indians can do it. So this also is possible there. Today, surgeons are not playing as astronauts, and the day is not far. The surgeons also may be able to go over there. But when you go over there, by the time the technology also will be used to you, such that you are going for a space tourism. You can also have a space surgeons also going further. It's not very far. Thank you very much for the opportunity.